Hey everybody, it's Jeremy Osterberger. We're at the Environmental Health and Safety Seminar and Industry Trade Show in Galveston. I'm here with Danny Forrest, Director of Data Analytics for Responsible Care with the American Chemistry Council. Danny, talk a little bit about the program. What is Responsible Care for folks that don't know?
Yeah, sure. Well, how about this? Why don't I start out with what ACC is?
Sure.
So we're a national trade association out of Washington, D.C. Our bread and butter is advocacy, but we're full service. So we have technical programs, we have advocacy programs, regulatory, and really everything that touches the chemical industry. So to answer your question, what is Responsible Care? It's our commitment to environmental health, safety, and security within the chemical industry. And that means a lot. It means transparency, it means continuous improvement, it means doing what's right and going above and beyond the regulations.
So Danny, digging into that further, I mean, who participates in Responsible Care, or operators, what are size and scope of, what is their size and scope? Tell us about who participates in the program.
Yeah, sure. So Jeremy, the program itself is a requirement for all ACC members. Okay. If you want to be an ACC member and you're an owner-operator within the chemical industry, you have to practice responsible care. This means everyone from the largest companies, the ones that you hear every day, the Dows, the DuPonts, the Exxons, all the way down to the smallest organizations that might have a single facility. They might have fewer than 100 employees at that facility. They all manufacture chemicals that make our everyday life possible.
Danny, in Responsible Care, what are kind of the geographic focus? Are we talking Gulf Coast, U.S. domestic? How far does Responsible Care reach?
So naturally, we think of the United States as being our boundaries. After all, we are the American Chemistry Council. But Responsible Care actually got its roots back in the early 80s in Canada. And shortly after that, the American Chemistry Council picked it up. And since then, we've been on a mission to spread it globally. We're in almost 70 economies now. That is every single continent. We have a big emphasis right now in Africa. We have a lot of work going on in Latin America, and we're spreading to Southeast Asia. And we're really proud of how well we've been able to spread that.
But I assume most of those members are all based at American companies. I mean, is that an accurate statement or not necessarily?
Actually, not necessarily. So each Responsible Care organization within its respective company has autonomy to do what they want within the guidelines of our EHS and S framework.
Gotcha.
So you do have multinationals that do share memberships across all of these countries that we talk about. But the good thing is you've also got the mom and pop shops that have now access to this framework, and they can use it in some of these countries where the regulations aren't as robust or the resources aren't as robust.
And so that is some of the benefits. You're kind of now getting into some of the benefits. Like, hey, I'm a member of Responsible Care. What do I get out of it? That's my question.
Yeah. So I mentioned that Responsible Care is mandatory for all ACC members, right? Well, that means a lot. Here in the United States, anyway, our framework is very rigorous, very robust, and it means really 5 different things. It means CEO or executive level commitment. They actually have to sign a contract saying, we're going to do this. We're going to keep our employees safe. We're going to drive continuous improvement within our organization. And we have codes and we have technical specifications that help them do that.
Okay.
So CEO executive level commitment, transparency in metrics. So metrics reporting. We collect metrics on occupational process safety all the way to air emissions. Quite a bit of data, and we do a lot of analysis with that data. We actually share a lot of that data publicly. You can find it on our publicly facing website. So anyone, it doesn't matter if you're a reporter, a legislator, or just a common community member, you have access to that data. Then we have our Responsible Care Management System. And a requirement of being part of ACC and Responsible Care is you have to implement that management system into your safety management system at your facility and at your headquarters. And we do that through providing technical specifications and codes. We have process safety code, security code, and product safety code. And then going beyond that, another requirement is you have to be audited. So we have a regularly scheduled audit for every single member to audit their headquarters and their facilities. It's all driven third party, and that gives an additional layer of validity to it. And that helps us maintain accountability to ensure that our members are doing what's right. And of course, our members want to do what's right. That's why they are part of the American Chemistry Council.
That's amazing. Thanks for that explanation, Danny, for folks that didn't understand the structure of responsible care, too. So, two things that I think ACC, responsible care, and BIC are aligned with is sort of community engagement and really activation within the industry, right? Talk about y'all's role in that.
Sure. So this is actually a big one, and a big one to me as well.
Yeah.
I grew up in Lake Charles, Louisiana. My dad worked in a chemical plant and a refinery. I had friends, same situation. And so engaging the community is so important. And luckily for me, that is a key pillar to responsible care, community engagement. I'll focus a little bit on one of our initiatives, and we call them CAPS, Community Advisory Panels. Around here in Houston, they're everywhere. They're in every little community, Pasadena, LaPorte, Baytown, and it's an opportunity for the community and the industry to come together in person, face-to-face, and create that dialogue. The industry can receive feedback. We can help come to an understanding of why we're doing what we're doing. If there's any major concerns, they can hopefully be addressed, or at least they can be brought to light in that venue where we have a collaboration with the community. And whenever I say community, I'm not just talking about local government entities. I'm talking about your neighbor, the everyday Joe that might work at the bank or might work, at a restaurant. They are welcome to join in on these dialogues.
Oh, that's neat. Yeah, I guess I didn't understand the full breadth of that either. So appreciate you saying that. Yeah, let's get into your partnerships. Again, much like BIC, similar partners. TCC, LCA, LCIA, the safety councils like Health and Safety Council, Alliance Safety Council, IBR. Talk about those partnerships. Why are they so important to your success?
Right. So I'll start with the Texas Chemical Council, sure. Texas Chemistry Council.
There we go.
So TCC and ACC, I get a lot of feedback saying, aren't y'all the same organization?
That's right.
We're not actually the same organization, but we have extremely similar missions. We are advocating for the chemical industry, and so we work constantly together on aligning on policies, identifying priorities for the chemical industry. We have a widely shared membership, and so we're constantly kind of working hand in glove in that same realm. When it comes to other nonprofits, BIC, HASC,
yep.
ECMA, we have very similar missions again. So it's actually part of my role being in Houston is interacting, establishing those relationships, making sure that our service to our members is aligned with their priorities.
Gotcha.
And so being that liaison, we are constantly collaborating and trying to identify ways to continuously improve.
Danny, thanks so much for hanging out with us. One last question for you. If someone wants to get involved with responsible care, what's the best way they can find you?
Yes, so obviously they can reach me through you guys. They can reach me through the website. There's just a couple things. We've probably got 4 different membership categories. Obviously, the owner-operators that manufacture. We've got our Responsible Care Partner Program, which are the distributors, the bulk truck carriers, the warehouses, the service contractors that work within the fence line. And then we've got our affiliates, who are the engineering firms, the consultants, the advisors. And those are all different avenues to get involved with the ACC and get involved with responsible care as well.
Sweet. Well, Danny, thanks so much for your time, and always great to catch up with you.
Yeah, absolutely. Thanks for having me, Jeremy.